Hi doctors, let's talk about something we've all experienced, those moments when a float caregiver steps in, and things just feel off. The patient's on edge, the caregiver looks unsure, and even the best routines start to break down. Why does this happen? Well, float caregivers are often walking into a patient's world cold. They might not know the patient's routine, how they like their meals, the subtle signs of agitation, or even basic preferences that the regular caregiver just knows by heart. And when there's little or no handoff between caregivers, that's when things really start slipping through the cracks. It's not about a lack of skill, it's about a lack of context. Each caregiver brings their own style, and that's not a bad thing, but if it clashes with what the patient is used to, you're going to see resistance. Especially in patients with cognitive challenges like dementia, that change can feel disorienting and even distressing. And let's not forget the caregiver's experience. Walking into a shift without a clear picture of the patient's needs? That's stressful. They're expected to perform, to connect, and to deliver quality care, but with none of the relationship or knowledge that normally makes it possible. That's exactly where Staffingly steps in. Staffingly simplifies the onboarding process for float caregivers. Before they even show up for their shift, they've got access to the patient's detailed care plan history, routines, preferences, alerts. Plus, the communication tools built into the platform keep regular caregivers, float staff, and families all in sync. Everyone's on the same page, which means less guesswork and more consistency in care. And when it comes to training, Staffingly ensures float caregivers are prepped and confident. That way, they're not just filling a spot. They're stepping into a role with clarity and purpose. So doctors, if you've ever felt the strain of disjointed care transitions or seen patients suffer because of inconsistent handoffs, there's a better way. With Staffingly, onboarding float caregivers doesn't have to be a gamble, it can be a smooth, well-informed process that protects the quality of care your patients deserve. If this video was helpful, go ahead and hit like, share it with your care teams, and don't forget to subscribe for more conversations on building smarter, more connected healthcare systems. Thanks for watching, and as always, keep leading with care.